You went to bed last night feeling completely normal, no warning signs, no discomfort, nothing that suggested a problem. And yet, while you were asleep, something subtle may have been happening inside your body, your brain receiving less oxygen than it actually needs. Not because of illness, not because of medication, but simply because of the way your head was positioned on your pillow. That idea sounds small, almost too simple to matter, but what I'm about to explain has nothing to do with diet or exercise, and chances are no one has ever pointed it out to you before. I'm Dr. Franklin, and over the years I've spent analyzing cardiovascular and neurological patterns in people over 60. One quiet trend keeps showing up again and again. It's not discussed enough, and yet it affects people every single night. The way you sleep, the angle of your neck, the direction your body faces, the alignment of your spine directly influences how efficiently blood flows to your brain. And here's the part most people don't expect. Stroke risk is not evenly distributed throughout the day. It actually spikes in the morning, increasing significantly between 6 a.m. and noon. This rise is linked to the natural surge in blood pressure that happens after waking up. That's not random. What happens during the hours before that surge while you're asleep plays a major role in how your body handles it. If your sleep position is limiting circulation, compressing vessels, or interfering with oxygen flow, your body enters that morning window already under stress. So before you brush this off and think, I've been sleeping like this for years, stay with me because what feels normal isn't always harmless. Over the next several minutes, I'm going to walk you through 6 common sleeping mistakes. Some of them seem minor at first glance, but their long-term effects can be serious. And after that, I'll show you 2 positions that research consistently links with better brain and heart health. But before we go any further, take a second and think about your own habits. Are you someone who sleeps on your back, your side, or your stomach? Keep that in mind because it's going to matter more than you think. To really understand why this matters, you need a bit of context. When you're younger, your body is incredibly adaptable. Your blood vessels are flexible, your circulation adjusts easily, and even awkward sleeping positions don't cause lasting issues. You might wake up with a stiff neck, but your system quickly recovers. However, as you move into your 60s and beyond, things begin to change. Arteries become less elastic. The smaller vessels supplying your brain lose some of their flexibility. Your body's ability to regulate blood pressure, especially during sleep, slows down. There's also something called nighttime blood pressure dipping. In a healthy system, your blood pressure drops by about 10 to 20% while you sleep. This is essential. It gives your heart and blood vessels time to rest and recover. But if your sleeping position interferes with circulation or breathing, that natural dip may not happen properly. Instead of recovery, your body stays in a mild state of strain all night long. That's the foundation you need to understand everything that follows. Your sleep position isn't just about comfort. It's about whether your brain is getting the blood and oxygen it needs for hours at a time. Now let's start with the first mistake, and it's one that surprises almost everyone. Sleeping completely flat. No elevation, little to no pillow, your body fully horizontal. It sounds ideal, right? Many people believe it keeps the spine aligned and reduces strain, but there's an important detail that often gets overlooked. When you lie flat, especially as you age, blood and fluid distribution inside your body changes. Without even a slight incline, cerebrospinal fluid, the fluid that cushions your brain, can begin to pool. This can increase pressure inside the skull. At the same time, the small blood vessels in your brain are dealing with slightly higher pressure for hours. It's not dramatic, but it's constant. And over time, that matters. Some people notice this as a dull headache in the middle of the night or early morning, a heavy feeling behind the eyes or at the base of the skull. It's easy to dismiss, but it may actually be your body signaling that something isn't quite right. And the surprising part? Fixing it doesn't require anything complicated. A slight elevation, just a small angle, can make a measurable difference. But before I show you exactly how to do that, there's another mistake that takes things even further, and it starts with a position many people think is completely harmless. If sleeping flat seems harmless, the next position takes that risk to an entirely different level, and it's one that many people have relied on for decades without thinking twice about it. I'm talking about stomach sleeping. At first glance, it feels like a neutral choice. You're not putting weight on your chest, your back feels supported, and it can even feel comfortable enough to fall asleep quickly. But the real issue isn't what you feel in the moment, it's what's happening structurally while you stay in that position for hours. The problem begins with your neck. When you lie on your stomach, you cannot breathe with your face pressed straight into the mattress. So your body naturally turns your head to one side. And not just slightly, you're often rotating your neck close to its limit, sometimes up to 90 degrees. Now imagine holding that position completely still for 7 or 8 hours. That's not a brief stretch or a momentary twist. That's prolonged, sustained rotation. Running along both sides of your neck are the vertebral arteries. These arteries are critical because they carry blood directly to the brainstem and areas responsible for balance, breathing, and coordination. When your neck is turned sharply and held there, those arteries can become partially compressed. The flow doesn't stop, but it becomes restricted, similar to what happens when you bend a hose. The water still passes through, but not as freely as it should. For a younger person, the body compensates, circulation adjusts, tissues recover, and the system corrects itself, but as the body ages, that flexibility decreases. Over time, repeated restriction, even mild, can begin to add up. It's not something you notice immediately. It's something that builds quietly. And there's another layer to this. When you sleep on your stomach, your chest is pressed against the mattress. That pressure limits how fully your lungs can expand. Each breath becomes slightly shallower. You're still breathing, of course, but you're not reaching the deep, full breaths your body needs during sleep to properly oxygenate your blood. Over the course of an entire night, that small reduction in oxygen adds up in a way most people never consider. So now you have two things happening at the same time. Blood flow to the brain is slightly restricted because of neck rotation, and oxygen intake is reduced because of limited lung expansion. On their own, each might seem minor. Together, night after night, they create a pattern your body has to work harder to manage. This is why some people wake up feeling unusually tired despite sleeping for a full 8 hours. It's not always about how long you sleep, it's about how well your body functions during that time. If this sounds familiar, don't worry, this isn't about making drastic changes overnight. Awareness is the first step. Even shifting partially away from a full stomach position can begin to reduce these effects. But before we talk about solutions, there's another habit that seems helpful on the surface, but can quietly create a similar kind of strain. Let's talk about pillows. Most people assume that if one pillow is good, 2 or 3 must be better. Maybe it helps with breathing, maybe it feels more comfortable, or maybe it's just become a routine over the years. But stacking multiple pillows under your head changes the angle of your neck in a way that mirrors the same issue we just discussed, only this time, instead of rotating the neck, you're pushing it forward. When your head is elevated too much, your chin naturally tilts down toward your chest. This forward bend, known as cervical flexion, creates pressure on the same arteries responsible for delivering blood to your brain. But it doesn't stop there. There's also a major vein in your neck called the internal jugular vein, which is responsible for draining blood away from your brain. When your neck is bent too far forward, that drainage pathway can become partially restricted. Blood doesn't flow out as efficiently, and pressure can begin to build. At the same time, your brain relies on that drainage system to clear metabolic waste during sleep. If that process slows down, you may wake up feeling mentally foggy, heavy, or not fully refreshed. A lot of people describe this as just feeling off in the morning. Not sick, not in pain, but not sharp either. And they often don't connect it to how they slept. The solution here is surprisingly simple. Instead of stacking multiple pillows, the goal is to use one supportive pillow that keeps your neck in a neutral position. Not too far forward, not tilted back, just aligned with the natural curve of your spine. Many people notice a difference within days of making this change. At this point, you might be realizing something important. These habits don't feel dangerous, they feel normal. That's exactly why they're so easy to overlook. But we're just getting started, because the next mistake isn't about your neck or your breathing alone. It's about the direction your entire body faces while you sleep, and for certain people, especially those with heart-related concerns, this one can quietly place extra strain on your cardiovascular system without you ever realizing it. Now here's where things start to get even more specific, and for many people, more surprising. Because up to this point, we've talked about positions that clearly affect the neck and breathing. But this next one involves something most people never think about: the direction you face when you sleep on your side. Side sleeping is often recommended. In general, it's considered one of the better positions for comfort and even for breathing. But what rarely gets mentioned is that not all side sleeping is equal. The side you choose can influence how your heart and circulation behave throughout the night. Let's focus on right side sleeping. For someone young and completely healthy, this might not create noticeable issues. The body adapts, circulation adjusts. But as we age, and especially if there's any history of high blood pressure, heart strain, or reduced cardiovascular efficiency, the picture changes. Your heart is not centered perfectly in your chest. It sits slightly to the left. That positioning matters. When you lie on your right side, gravity shifts the heart slightly away from its natural alignment. At the same time, the weight of your body presses into the right side of your torso. Running through that area is one of the most important veins in your body, the inferior vena cava. This large vessel is responsible for carrying blood from your lower body, your legs, your abdomen, your organs back up to your heart. It's a critical part of circulation, especially during rest, when your body is trying to rebalance and recover. When you lie on your right side, that vein can become partially compressed, not completely blocked, but enough to slow the return of blood. This means your heart has to work a little harder to pull blood back in and circulate it properly. It's a subtle increase in effort, but when it happens for hours every night, it becomes a pattern. Think of it like this. If your heart is already working near its comfortable limit due to age or mild health conditions, adding even a small amount of extra resistance night after night is not insignificant. Over time, it contributes to strain that most people never connect to their sleep position. What's fascinating is that some studies have shown patients with heart conditions naturally avoid sleeping on their right side. Not because they were told to, but because their bodies sense discomfort or inefficiency in that position. It's a quiet instinct, one worth paying attention to. So if you're someone who naturally sleeps on your right side and you've been dealing with unexplained fatigue, mild breathlessness at night, or even subtle discomfort, this might be a factor worth reconsidering. But before you think the solution is simply switching sides and you're done, there's another habit that often works alongside this one, making the situation even more complex. Let's talk about the fetal position. This is one of the most common sleeping positions, especially among older adults. Knees pulled up, shoulders slightly rounded, chin tucked down. It feels safe, warm, and familiar. For many people, it's the position they drift into without even thinking. And emotionally, it makes sense. It's a position that mimics protection, almost like the body is wrapping itself in comfort. But physically, it introduces several challenges all at once. First, your lungs. When your body is tightly curled, your rib cage cannot fully expand. Each breath you take is slightly restricted. Over time, that reduces the total amount of oxygen your body absorbs during sleep. It's not a dramatic drop, but it's consistent across every breath for hours. Second, circulation in your lower body. When your knees are bent sharply and held that way, the blood vessels behind them can become partially compressed. This can slow circulation to and from your legs. If you've ever woken up with stiffness, heaviness, or even mild swelling in your lower limbs, this could be part of the reason. And third, your neck returns to that same forward-tilted position we discussed earlier. The chin drops toward the chest, creating pressure on both arteries and veins. So now, instead of one isolated issue, you have multiple systems being affected at once: breathing, circulation, and blood flow to and from the brain. Individually, each of these might seem manageable. Together, they create a pattern where your body is working harder than it should during a time that's supposed to be dedicated to recovery. The key here isn't to completely abandon the position if it's what you're used to. It's about modifying it, slightly opening the angle of your body, reducing how tightly you curl, and using support like a pillow between your knees can make a noticeable difference without forcing you into something unfamiliar. By now, you might be starting to see a theme. These aren't extreme or unusual habits. They're everyday positions that feel comfortable and natural. That's exactly why they go unnoticed for so long. But the next mistake brings everything together in a way that's even more impactful. Because it's not just about how you sleep, it's about what you do before you sleep. And this one is incredibly common, especially in the evening routines of adults over 60. Up to this point, we've been focusing on positions, how your body is placed once you're already asleep. But what you do in the final hours before bed can quietly amplify or undo everything we've talked about so far. And this next mistake is one of the most common routines people follow without ever questioning it. Picture a typical evening. Dinner around 7 or 7:30, maybe something warm and filling. Then a bit of relaxation television, perhaps a small dessert, sometimes even a glass of wine to unwind. By 10 p.m., you're in bed, ready to sleep. It feels normal, balanced, even healthy. But inside your body, a very different sequence is unfolding. After a full meal, your body immediately redirects a significant amount of blood toward your digestive system. This is necessary. Your stomach and intestines need that blood flow to process and absorb nutrients. But here's the key point, that blood is coming from somewhere. And in older adults, where circulation is already less adaptable, this shift can create short periods where other areas, including the brain, receive slightly less blood than they ideally should. In a younger body, this redistribution happens smoothly. The system compensates quickly, and everything stays balanced. But with age, the response slows down. Arteries are less flexible, and the nervous system that regulates these shifts doesn't react as efficiently. So instead of a seamless adjustment, you get subtle dips, moments where blood flow to the brain isn't quite optimal. Now layer alcohol into that picture. Even a single glass of wine changes how your blood vessels behave. Alcohol acts as a vasodilator, meaning it relaxes and widens your blood vessels. At first, this lowers your blood pressure, but your body doesn't just accept that drop, it tries to correct it. So it tightens vessels again, pushing pressure back up. What you end up with is a cycle. Pressure falls, then rises, then falls again. This fluctuation can continue throughout the night. And if your blood vessels are already dealing with stiffness or mild plaque buildup, those repeated changes create stress on the system. This is why some people wake up suddenly in the middle of the night with a racing heart or a strange sense of unease. It's easy to blame a bad dream or dehydration, but often it's your cardiovascular system reacting to these internal shifts, trying to stabilize itself. There's also another layer here, sleep quality. When your body is busy digesting a heavy meal or processing alcohol, it doesn't fully enter the deep, restorative stages of sleep. And those stages are exactly where your brain clears waste, resets hormonal balance, and restores sensitivity to things like blood pressure and oxygen levels. So even if you sleep for 7 or 8 hours, the quality of that sleep is reduced. You wake up feeling like you rested, but not fully recovered. Over time, that gap begins to show in your energy, your focus, and even your long-term cardiovascular health. The adjustment here is not about eliminating enjoyment from your evening, it's about timing. Finishing your last meal at least 3 hours before bed gives your body enough time to complete most of the digestive process while you're still upright. If you choose to drink alcohol, stopping 4 to 5 hours before sleep reduces those nighttime fluctuations significantly. And one of the simplest, most overlooked habits? A short, gentle walk after dinner. Not exercise, not anything intense, just movement. It helps your body begin digestion, stabilizes blood sugar, and allows circulation to settle before you lie down. Now, when you combine this awareness with everything we've already discussed, neck position, breathing, circulation, you start to see the bigger picture. Sleep isn't just about closing your eyes. It's an active biological process where your entire system either recovers or struggles. And that brings us to the most important part of this conversation, because it's not enough to know what to avoid, you need to know what actually works. There are 2 positions that consistently stand out in research when it comes to supporting both brain and heart health, especially as we age. These aren't trends or opinions. They're backed by how the body is structured and how blood flows naturally. The first one may already feel familiar to some of you, but the reasons behind it are deeper than most people realize. And once you understand why it works, it may completely change the way you think about something as simple as turning on to one side when you go to sleep. And this is exactly where the pattern starts to become impossible to ignore, because mistake number 5 isn't just about comfort. It's about a position that quietly reduces the quality of every single breath you take throughout the night. The tightly curled fetal position feels natural, almost protective. Many people slide into it without thinking, especially after years of habit. Knees pulled up, shoulders rolled forward, chin tucked down, it creates a sense of security that the body recognizes instantly. But beneath that comfort, there are several physiological trade-offs happening all at once, and they add up over time in ways most people never connect back to their sleep. When your body is tightly curled, your rib cage cannot fully expand. That means your lungs are physically restricted from taking in a complete breath. Each inhale becomes slightly shallower than it should be, reducing what's known as tidal volume, the amount of air your lungs can move with each breath. One shallow breath isn't a problem, But thousands of slightly reduced breaths over the course of a full night create a measurable drop in oxygen delivery. And after the age of 60, your body doesn't compensate for that reduction as efficiently as it once did. At the same time, the position of your legs introduces another issue. With your knees bent and pulled upward, the blood vessels behind them, especially the ones located in the popliteal region, can become partially compressed. This restricts circulation through the lower limbs. If you've ever woken up with heavy legs, mild swelling around your ankles, or a subtle tingling sensation, this position may be contributing more than you realize. It's not dramatic, it's not painful enough to alarm you, but it's consistent, and consistency is what creates long-term impact. Then there's the neck. Just like we discussed earlier, the fetal position naturally pulls your chin toward your chest. That forward bend cervical flexion affects both blood flow into the brain and drainage out of it. The vertebral arteries may experience reduced flow, while the jugular veins may not drain as efficiently. And when that happens, pressure inside the skull can gradually rise throughout the night. You might not notice it immediately, but the next morning it shows up as brain fog, heaviness, or that frustrating sense that you slept long enough but didn't recover properly. Studies in respiratory physiology have confirmed that sustained spinal flexion reduces breathing efficiency. And when you multiply that small reduction across every breath for 7 or 8 hours, the cumulative effect becomes significant. Less oxygen, less circulation efficiency, and less effective waste clearance in the brain. None of this happens suddenly. It builds slowly, night after night, which is exactly why it goes unnoticed. But here's the important part: you don't need to abandon the position entirely. The goal isn't to force your body into something unnatural, it's to modify what already feels comfortable. A simple adjustment can make a meaningful difference. Placing a body pillow between your knees helps open up the hip angle slightly, reducing compression in the lower body. Allowing your torso to stay just a bit more extended rather than tightly curled gives your lungs more room to expand. Even a small shift in how tightly you hold that position can improve both breathing and circulation without sacrificing comfort. Now, as we move into the final mistake, this is where everything we've discussed begins to overlap and amplify. Because mistake number 6 isn't just about position, it's about what you do before you even lie down. And it's one of the most common habits people never question. Late meals and alcohol close to bedtime create a completely different internal environment while you sleep. After you eat, your body redirects blood toward your digestive system. This is normal. It's how your body processes nutrients. But in older adults, that redistribution isn't always perfectly balanced. Blood flow to the brain can become slightly reduced during digestion, especially when combined with other factors like less flexible blood vessels or slower autonomic responses. Now add alcohol to that equation. Alcohol causes your blood vessels to relax and widen, which lowers your blood pressure initially, but your body doesn't leave it there. It compensates by tightening vessels again, causing fluctuations throughout the night. Instead of a smooth, natural drop in blood pressure during sleep, you get instability, ups and downs that place stress on your cardiovascular system. This combination, late digestion, fluctuating pressure, and reduced oxygen efficiency from poor positioning, creates the perfect environment for disrupted recovery. And what does that look like in real life? You wake up suddenly in the middle of the night. Your heart feels like it's racing. Maybe there's slight sweating, maybe a sense of unease. You assume it was just a dream or dehydration. But often, it's your body trying to stabilize itself after hours of internal imbalance.